Hello everyone. Now today let's talk about the diseases of the eyelids. Now we have discussed the anatomy of the eyelid and the structure of the eyelid in the previous video. So now let's talk about its various diseases. Now we have divided the diseases of the eyelids into the four categories. So first of all, the inflammatory diseases, then the various anomalies, the congenital diseases of the eyelid, and finally the tumors. So we will be covering them in this order. First of all, the inflammatory diseases, which is and today we are going to talk about the Chalazion in this video. So inflammatory diseases, in these diseases you will see that there is an inflammation of the eyelid. On the other hand, in the anomalies there will be some anatomical defect that will occur in the eyelids. As far as the congenital are concerned, you know that it will be congenital, and finally the tumors, that is the neoplasia will be there. So starting with the inflammatory diseases, today we will be covering Chalazion, and then the hordeolum and blepharitis will be covered in the other videos. So now let's have a talk about the Chalazion. Now what exactly is Chalazion? So Chalazion is actually a non-infectious swelling of the eyelids. So you have to remember it, the non-infectious swelling of the eyelids, and due to the obstruction of the ducts of the sebaceous gland that appears as a slow glowing lump. Now here, this thing you have to highlight it here, that it is a non-infectious swelling. On the other hand, you will see the hordeolum, that and the next one, the hordeolum, as well as the third that we have in this, the blepharitis, that will be mainly infectious swelling. So Chalazion is a non-infectious swelling of the eyelids, and it is due to the obstruction of the ducts of the sebaceous gland. So the ducts of the sebaceous gland gets obstructed, and once they get obstructed, they get prone to the inflammation, and that inflammation, once it occurs, then it is called as Chalazion, and it appears as a slow growing lump, which means that it won't be something acute. It will take some time to develop. So the patient will come with a history that this lump has developed over time, a few times, some time is taken, and it mostly affect the upper lid. Why it mostly affect the upper lid? Because there is a large number of the meibomian gland, which are the sebaceous gland that are present in the tarsal plates. The meibomian glands, we have discussed in the structure of the eyelids. So that those meibomian glands are present more in the upper eyelid, so that's why that's why the Chalazion mostly occur in the upper eyelid. Now let's talk about its etiology. So we have just studied its cause, that this obstruction will be that there will be an non-infectious obstruction of the ducts of the sebaceous gland. Now you do remember we have two types of sebaceous gland in the eyelid. If you do remember the structure, that anteriorly we have the gland of Zeus, whereas posteriorly in the tarsal plate we have the gland or the meibomian gland. So any of these glands may be obstructed, and that obstruction should be non-infectious, and that non-infectious obstruction, once it lead to the inflammation and swelling, so that is called as Chalazion. And these are actually Chalazion is actually precipitated by the hypercholesterolemia. So you have more excessive production of the sebum or the oily secretion in the hypercholesterolemia, so that's why it is precipitated by that. And it is also precipitated by diabetes mellitus and blepharitis. Blepharitis is actually the swelling or the inflammation of the eyelid, so it is the diffuse inflammation of the eyelid, as you will see. Now this is etiology. Now how does this swelling or this inflammation occur? Its pathogenesis. So first of all, we have just discussed that there will be obstruction of the duct, and once that obstruction occur, what happens, that there is retention of the lipid secretion, since it is obstruction of the duct or orifice of the sebaceous gland, and sebaceous gland secretes lipid secretion. So once those retains, what happens, that the lipid degradation occurs due to the enzymes, and this lipid is degraded into the pro-inflammatory fatty acids, and these pro-inflammatory fatty acids then leads to the inflammation, and the lymphoid cells came and the giant cells came, and they surround the acini of the sebaceous gland as well as the secretion. So as a result, the granulomatous appear, the granulomas are formed, and hence a painless nodule is formed, and this painless nodule appears outside as a Chalazion. So that's its pathogenesis. Duct blockage, retention that leads to the pro-inflammatory fatty acids due to the degradation, then inflammation occurs, and as a result granuloma is formed, that is called as chalazion. As far as its clinical presentation, now the clinical presentation is concerned, so we actually diagnose it clinically. So how we diagnose it, that there will be a painless swelling. Now this is a high yield point, you have to remember it, because you will see that the next thing, the next disease that we are gonna cover, the hordeolum, so that will be painful swelling. However, chalazion is a painless swelling, and it is actually slow growing nodular swelling. That means we have discussed it, that it will be slow growing because the giant cell formation, granuloma formation, that takes a bit of time. Then there will be mechanical ptosis, because once you have a large lump in your upper eyelid, mainly it affects the upper eyelid, so once you have that, so it will cause the mechanical ptosis. And there will be conjunctiva erythema. So the conjunctiva that is below the chalazion, that will show erythema. I will just show the pictures of each of these points shortly. So the conjunctiva may show fleshy mass if ruptured. If the conjunctiva that is below the chalazion, if that is ruptured, then it will show a fleshy mass, and it may cause blurred vision due to astigmatism. Now astigmatism is actually what when the light is not equally distributed inside the eye. So what happens is astigmatism is mainly due to the not proper when you don't have proper surface of the cornea. So what happens that the light is not refracted properly in all directions, and that what leads to the blurred vision due to the astigmatism. So once you have that fleshy mass over the cornea, once it touches the cornea, so it may cause uneven surface of the cornea, and that may lead to the astigmatism. So these are its clinical points that you must remember. And here you can see this is chalazion, and you can see it is a nodular swelling, focal swelling. In the blepharitis, you will differentiate it from blepharitis, that in blepharitis the whole of the eyelid will be involved, whereas in chalazion you can see a focal area is involved. And how are you gonna differentiate it from the hordeolum? The hordeolum is also going to be a focal swelling like that, but hordeolum will be painful swelling, while this swelling will be painless swelling. Here is shown the undersurface, the conjunctiva. You can see there is erythema of the conjunctiva, and the just below it here is chalazion lying. So here you can see the erythema. So hope you have understood the clinical features of the chalazion. Let's move ahead. So the complication, that what is going to happen if you let it untreated. So mainly spontaneous resolution may occur. So chalazion may spontaneously resolve itself. However, it may get infected. We have discussed it, that this is just obstruction, and that obstruction lead to the inflammation. There is no infection in chalazion. However, it may get infected, and that may lead to pus production, separate mean pus production. So if it is get infected and the pus is produced, then we call it hordeolum. So the hordeolum, you will see in the next video that the hordeolum is actually when you have obstruction, and that is followed by an infection. Now this so this may occur, it may liquefy to form chalazion cyst. Now the inside the lipid that we have, it may liquefy and it may form a cyst, so that is called as chalazion cyst. Or it may burst into the conjunctiva as a fleshy mass. The undersurface may burst, the conjunctiva that is, so it may burst, and all the fleshy mass that is present in this lump, it may move from inside and it appears as a fleshy mass as shown here. Now if it is fibrosed or it is calcified, the inner mass, so fibrosis or calcification may lead to the formation of the hard nodule. Moreover, we have discussed that the mechanical ptosis will occur, since this lump present over here, ptosis is actually the drooping of the eyelid. So once you have that mass on the upper eyelid mainly, so it will cause that there will be drooping of the lid, and this will be mechanical ptosis. And astigmatism, we have discussed it, that if this lump get over the cornea, so it may lead to the uneven surface of the cornea, and that uneven surface of the cornea will cause the light to refract in different pattern at the different sides, and that will lead to the blurred vision of the astigmatism. So these are all its complication. Now finally, we will, how are we gonna treat the Chalazion? So the Chalazion is mainly treated by the conservative treatment, since it is no infection, nothing is involved, just inflammation. So mainly the conservative treatment will help, and it helps in the spontaneous remission, as we have said that it may spontaneously resolve. So the conservative treatment will actually help the spontaneous remission. Now there is lid hygiene. So lid hygiene, how you're going to do it, that massage and all that stuff over the lid. So what will that do? That it will help the duct opening, since it is, we have said that it is obstruction of the gland. So that if that obstruction is resolved by massage, so what happens, that your Chalazion may resolve. Moreover, hot fomentation and compression are applied. So hot fomentation, the hot some hot substance is taken, so that should be as hot to bearable hot, so that is taken and that is compressed over the Chalazion in order to liquefy the lipid secretion, the lipid that is inside. So that will liquefy, and thereby encouraging the resolution of the ductal blockage and facilitating the drainage of the sebum. So that will help. And if that doesn't help, then you have the medical treatment. You do the anti-inflammatory and antibiotic combination drops are usually applied topically, and this is used because this has a higher any collection of this sebum, it has higher probability to get infected. So you do that, the antibiotics are given, antibiotic drops, and the anti-inflammatory drops are also given to prevent the conjunctivitis or any other inflammation around. Moreover, corticosteroids injection, that is again the anti-inflammatory agent, so that is may be used, and systemic antibiotics are given to prevent the spread of the infection and to resolve this if there is an infection, so to resolve it. Now the surgical treatment, now this, if the medical treatment and the conservative treatment doesn't help, then we have the final option of this surgical treatment, in which we do the incision and curettage. So that incision is given, and all the lump that is inside, the stuff that is inside, that is cleared out. So once that is cleared out, then we won't have the Chalazion, and that will be resolved. So that is all about the Chalazion treatment, and that is all about the Chalazion. So I hope you have understood it, and do subscribe my channel for the further upcoming videos. And in the next video, we are gonna talk about the next video, that will be hordeolum. So stay tuned. Thank you.